welcome everyone online and as well as in the room. We've got our second policy forum in the series Safety is No Accident, Public Health Approaches to Injury Prevention. And today we're going to be talking about injury prevention at work. My name is Kathy Narline. I'm a past president of MPHA. The current president is home with a sick child. But I want to welcome everyone. And before I introduce our moderator, I'd like to read the ancestral land statement. We ask that you take a moment to honor and acknowledge that we are on ancestral homelands of the Dakota and Anishinaabe. Indigenous peoples have a long-standing history and connection to the land since time immemorial and are the original stewards of land and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonization and U.S. government policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors, descendants, as well as the land itself. So today, our panel will address workplace and worker safety. They will be examining safety measures and training programs designed to keep workers and the workplace safe. And without further ado, I'd like to introduce Annie Holland. Annie will be our moderator today. She's UCare's County, Tribal, and Public Health Manager. And I know Annie because she's been a co-chair of MPHA's Policy and Advocacy Committee and has been a champion for individuals living in the margins, the homeless, people who are eligible for both Medicare and Medicaid, and she's been a great voice for people without, sometimes without a voice. So without further ado, Annie, if you want to take over, and thank you for being here.
Thanks, Kathy. Morning, everybody.
Good morning.
Hello, and hi, folks online. Thanks for joining this morning. So we've got a great panel this morning. I'm very excited. I have to say I'm a novice when it comes to occupational health and workplace safety, so I'm in the role of the audience, I think, in this situation where I'm sort of learning as we go. And, you know, I have to say it's wonderful to be back in person. Last season for the forums, we were all virtual. So it's really nice to have the opportunity to have some people in the room and to be here together and to meet you all in person. And also to have that ability to have people online. And I think this sort of speaks to the workplace adaptations that we have in place now after the COVID pandemic restrictions that set in. I just wanted to touch on a couple of things before we go into the introductions for each of the panelists. And we were actually just talking at the table about a global workplace phenomenon that just occurred and was in the headlines with the contentious World Cup setting in Qatar, where the Qatari government admitted to 400 to 500 deaths of migrant workers in the stadium construction, and some foreign press estimated far greater numbers than that, more in the thousands, and you know, untold, unreported injuries amongst the migrant workers that were mostly from India and Nepal, suffering the impacts of heat and other injury. So while it's tempting to look very far and from a very different country and to make some judgments on that, you know, we're really here to talk about how the U.S. is doing in terms of safety protections for workers, all workers, including migrant workers, in agriculture, service, and construction. And then, of course, you know, as we all know, our COVID has impacted workplace settings of all kinds. You know, primarily speaking from my own experience, my office situation has changed quite a bit, right? I'm no longer working in a big office building and working from home, where my occupational safety hazards are probably my children and my cat. Maybe some hurt feelings by a poorly worded email, but that's about it for my home. Anything else is my own responsibility because it's in my own home. But of course, there are workplace settings, particularly for lower wage workers in service industries and agriculture, hospitality, nursing homes, that are, of course, having to be in person, education, of course, teachers. So I'm really excited to talk a little bit more about how the last few years have changed workplace settings have changed the safety rubric for all of those workplace settings. And then just a touch on MPHA and some things that we've talked about through the years with regard to workplace. I know when I was the co-chair of the policy committee, we passed a few resolutions on one on earned sick and save time and one on paid family leave. So MPHA has been really talking about this connection, about the connection between health and the workplace setting, and how important paid leave is for, of course, social determinants of health, stability for employment, and reducing viral transmission. And then also, of course, paid family leave will have benefits that will have repercussions for parents and babies, as well as sick loved ones. So we're now looking at a legislative situation where we may have some protections passed this session. So this is an exciting time where we may actually see some changes made. It was a little surprising to not see some changes made on the federal level during the heat of the COVID moment, but we'll see where things go from here. So as I said, I am really in the learner seat this morning, so I'm going to be excited to learn all about your roles and your research. And we have a really great span of different areas of expertise on our panel this morning. So I'll just read the shortened bios, but you can also find the presenter bios online, the full bios. And then I'll have each of you take a few minutes to make some summary remarks, or some opening remarks, I should say. So our first panelist is Robert Servian. Robert Servian works for MNOSHA, Workplace Safety Consultation, as a safety consultant principal. His focus is on construction worker safety and providing trainings in Spanish and English. And then our next panelist in the middle here is Dr. Peter Rayner. Dr. Rayner is a professor in the Division of Environmental Health Sciences at the University of Minnesota School of Public Health, holding a BS in Chemical Engineering from Cornell and MS and PhD degrees in Environmental Sciences and Engineering from University of North Carolina at Chapel Hill. And then the last panelist is Dr. Jeff Bender. Dr. Bender is a professor at the School of Public Health and an adjunct professor in the College of Veterinary Medicine, currently the director of the NIOSH-funded Upper Midwest Agriculture Safety and Health Center, UMASH, which is the best acronym I've heard in a while, and a center focused on improving the health of agriculture workers and their families. So let's welcome our panelists. All right, and we'll start with Mr. Servian.
Okay, good morning, and I'm not sure if it's working. Yep. Okay. Well, my name is Robert Servian. I work for Minnesota. When accidents do occur, we do investigations to try to determine what was the cause of those accidents. I worked for before I worked for OSHA Consultation. I worked 10 years for OSHA Enforcement, and in that capacity, I had to do, basically investigate complaints, also go out and do accident investigations, and that by far was the kind of the hardest part of my job, where I had to go out and basically talk to and meet with family members of people that had gotten into workplace accidents, and that kind of wears down on you quite a bit. But what I learned is that from those 10 years of working with OSHA Enforcement is that that one chance in a million of something occurring, unfortunately does occur quite often, you know, and it seems that it's a lot more often than once in a million. So by far, prevention is the key right there. So don't take any shortcuts. You know, we try to emphasize that, play it safe, make sure that all the safety devices are in place. Currently, I do work with mostly with construction. The construction industry has a lot of issues with, especially falls and being hit by moving vehicles. And it's just the nature of that industry that lends itself to having a lot of accidents. Something we were just discussing just prior to this presentation here is the labor shortage and how that affects workplace safety. So those are some of the things I would love to talk a little bit more in detail later on.
Thank you. Thanks for having me here. So I'm Pete Rayner. I am a professor in the School of Public Health, but I also direct our industrial hygiene program. And for those of you who don't know what industrial hygiene is, it's the protection of workers, kind of the anticipation, recognition, evaluation and control of workplace hazards and hazards that may affect surrounding communities or communities surrounding workplaces. And I also lead the Midwest Consortium for Hazardous Waste Worker Training, where we have 13 training centers in 9 states around the Midwest, where we try to provide training to workers and community members on hazardous substances, hazmat, emergency response to hazardous spills, things like that. So those are a couple of my main roles. You know, I'm in my comments here, I'm going to, the focus is on safety, but I think of health and safety when I think of the workplace. And while safety is, you know, can be quantified sometimes a little more easily than health. So, you know, in some of the data that I think the MPHA put out to advertise this, they mentioned in 2021, the 5,190 deaths, fatal injuries in workplaces that were enumerated by the Bureau of Labor Statistics. And that's a lot. But there's also estimates that are harder to make for occupational disease and the impacts they have on deaths, because those come many years later often due to latency periods for diseases. And so there have been estimates. Now this is 20 years old. Steenland and co-authors in the American Journal of Industrial Medicine estimate total occupational related disease deaths in the U.S. as being between 26,000 and 72,000 per year. So that's a lot of people who may have deaths that are at least partially related to things they experienced in workplaces over their time there. And there's disagreement about those numbers because they're a little harder to enumerate sometimes. And we talk about fatalities, but there's also people's non-fatal injuries, non-fatal occupational diseases, people who are affected very severely sometimes by what they experience in the workplace. So all that is important in looking beyond just the easy counts, I think. One of the things that I'd be really interested in exploring more with you is with my Midwest Consortium, where we do hazardous waste worker training, there's a real focus on disasters now and disasters related to climate change. And you know, there's a lot of hazards that particular emergency responders, but also there's a lot of other responders who come in and try to do remediation of buildings after urban flooding, which is occurring more and more. So there's firefighters who experience smoke that is very different than it has been in, 30, 40 years ago. Smoke was mostly from wood. Now there's metals and plastics and many more things. And fortunately, our firefighters are much more aware of this, but they're still facing a lot of hazards and evidence of elevated rates of occupational disease. And heat, that was already mentioned, and as that's going to be increasingly a problem for us, particularly heat waves. I think about the Pacific Northwest, was that 2 years ago now, where they experienced over 100-degree temperatures in places that don't see that. So people aren't acclimated to those temperatures and are at much greater risk of severe effects of heat stress. And then kind of the last theme that we might want to touch on a little bit is total worker health and the nature of work together with total worker health, which is total worker health is kind of the policies and programs, practices that integrate protection from work-related safety and health hazards with promotion of injury and illness prevention efforts to advance worker well-being. So it's more a holistic approach towards having a healthy workforce, and that's a definition from the National Institute of Occupational Safety and Health. But there's a number of ways that intersects with work I do. We look at gig workers, so a very different way of working. People have a number of different jobs, some of them very poorly regulated. They're thought of as contractors, so think of your Uber driver or your Lyft driver or your Uber Eats delivery driver. So it's precarious employment, often vulnerable populations, could be immigrants, people who need the income. So if there is say a pandemic, they're unlikely to stop working as much as maybe others would, or their opportunities become even greater because people are ordering food from home. Of course, we all know there's still the misuse of opioids and other substances that has only gotten worse during the pandemic. Those have very serious safety concerns in workplaces too. If you have people who are compromised and they're operating heavy equipment, that can be a huge safety issue. There's also the aging workforce too, and changes in who will be doing certain types of work that can affect safety and injuries. So I'll stop my comments there. Those are a few things I'm interested in and be happy to talk more with you about.
I apologize if there's anything. This voice from the back. Well, it's a real pleasure to be here, and I thank you for this opportunity to share and actually brainstorm too. So I appreciate Pete's comments and just the chance to come together. So I am an infectious disease epidemiologist that somehow got roped into doing injury and occupational medicine. And so, and actually I thoroughly enjoyed it. I too am a learner in this continued process. And so what I thought with my comments briefly today is talk a little bit about what I do with UMash, the Upper Midwest Agricultural Safety and Health Center, maybe describe a little bit some of our past work and kind of what we're doing for the future. So we are funded by the National Institutes for Occupational Safety and Health. And our mission basically is to look at or minimize the disease burden, especially for basically agricultural communities. So the worker, the producer, and the rural farm family. So a real focus on rural health is really the main way that we're doing that. And we do that through research, education, and kind of outreach activities. The other thing that's, I think, very unique about our center is that it involves a number of colleges within the University of Minnesota, but also has strong ties and partnerships with Migrant Clinicians Network, so focusing in on some of those disadvantaged workers. Also the National Farm Medicine Center based out of Marshville, Wisconsin, and then also a strong partnership with the Minnesota Department of Health. So it's really a conglomeration of great partnerships that are trying to address the issue of agricultural workers. And our focus, primarily because of a little bit of our strengths, was on kind of diseases that are coming from animals, zoonotic diseases. But clearly we have expertise in injuries and kind of occupational safety issues. But then also we've been pulled into the need to address the mental health issues that we're experiencing throughout our workforce. And also just some of the changing facets of agriculture with the interest of bringing the public onto farms or agritourism related things, as well as just supporting ag education. We also take what we call a One Health approach, recognizing that in order to really have the best health outcomes for animals, for plants, for humans, we need to be interdisciplinary. We need to be collaborating, communicating, coordinating across multiple sectors in order to really address some very complex issues. So some of our projects have been quite varied. I mean, so we have one project that we're just finishing up. It's been going on for the last 10 years. Is how do we protect immigrant dairy workers? So 70% of the workforce on dairy operations here in Wisconsin and Minnesota are immigrant workers. And so, you know, and oftentimes they may have been around one cow, maybe in El Salvador, and all of a sudden they're in a place that has 1,000, 2,000 cows, and their cows are half the size of our cows. So, and so they just don't understand even how to counter behavior or some of the challenges on our modern dairies. We also been working with many of the big companies to try to get a better understanding, as Pete alluded to, just, you know, deaths are one thing, but that's really the tip of an iceberg of really what are the near misses and other issues that are happening in our workplaces. So trying to look at worker injury data with the companies themselves and trying to get a better understanding of that. And clearly we don't have very good data on that, and that needs to be looked at. The other unique project that we have is that looking at specific workforces that are interfacing with animals on a regular basis and what diseases that they might be more likely to get. So for example, we've had a kind of a cohort of veterinarians that we would actually do nasal swabs on to see if they had MRSA, methicillin-resistant Staph aureus. We do know that there's higher rates in this population, so why do they have it, and you know, is it causing injuries in that population? We also have been looking, actually, P here, has been looking at kind of airborne virus transmission, especially in confined agricultural operations. So it's kind of a neat project, and actually a fortuitous project, because it's looking mostly at influenza movement and transmission, especially in swine operations. Another aspect is that there are, you know, there's a systems thinking approach to looking at occupational safety and health. And one of the areas that is to identify trusted individuals that are working in those communities. One of those is volunteer firefighters. I mean, they're part of the community, they're trusted, and then how do we train them to be thinking about to be more health and safety minded? So we have a program that looks at basically volunteer firefighters and training them, especially in agricultural operations. So, and then specifically with our health department, we've been actually doing more active investigations, trying to understand occupational risk, especially for those that are picking up certain diseases. So these are the types of projects that you know, we've been doing. So I look forward to sharing a little bit more about those. But the other piece is that how do we become more active in our engagement? How do we actually develop more trusted partnerships with our tribal members, with the logging industry and others? And so how do we do part of that outreach? And so we've been working a little bit more actively to try to get out of the ivory tower and to meet some of our folks in the community and to understand what the risks are. So a couple years ago, we had a number of individuals that died of grain bin injuries or deaths, or you know, exposures to being, you know, gases, especially in grain bins. And so that actually spurred a number of local issues and needs for us to try to engage our local communities as well as legislators who are interested in developing that. Part of that outreach is how do we do checklists and provide checklists for them to think about, you know, if I'm working in this operation, you know, what things do I need to do if I am going into a grain bin? Part of that is the need to identify kind of emerging issues. Agriculture is not stagnant, and so how do we actually think about identifying what those new challenges are, reviewing what they are, and then also creating good partnerships to allow for interventions in that area. Some of these emerging issues are women in agriculture. Increasingly, they are playing a more important role and actually taking on more leadership with that. Recognizing that manure is a hazard, so how do we actually deal with, you know, the folks that are driving manure around, especially you know, late season, all day long, working, you know, 15, 18-hour shifts. The mental health challenges that we're seeing, especially in our rural communities, immigrant workers, and then as Pete alluded to, our aging workforce. We look specifically at farmers in Minnesota. Average age is about 58. And so how do we attract younger, newer farmers, and then also kind of prepare them for the future? And so the last comment I just would want to make, and I'll turn it back over to the moderator, is that, you know, when we look at the future, there's a couple things that we need to consider. Again, that One Health approach. How do we actually create responsive teams to address some of these complex issues? How do we involve educators and community leaders, university extension, healthcare providers, veterinarians, you know, as part of that process? Who do we need at the table to actually address some of these issues? So I look forward to your questions. So I turn it back.
Great, thank you. So gosh, there's a lot to unpack here. One theme that I heard from two of you, or actually all of you, was about injury, and I'd like to maybe talk a little bit further and dig into that. So if we could talk a little bit about what you all are hearing about, what's happening in terms of injury surveillance or reporting, because Dr. Weiner, I think you mentioned that there's some contention around numbers currently. So is there any active work going on to determine some and decide on some standards and in terms of collecting and reporting out information?
Well, I guess I can talk more about the problems and what I'm aware of with the solutions, and maybe my co-panelists can talk if they know more about this.
I'm sorry, I muted it just because I thought I would drop it.
It's
There
back,
you go.
it's back on again. I unmuted, so it seems like there's a lag maybe. I forgot my question.
Yeah,
sorry. So you know, so with injuries, fatal injuries are probably the best collected data because they're fairly well, you know, they're plain. Non-fatal injuries are very challenging because they have to be recorded in order to be counted. And then not all states report that to the Bureau of Labor Statistics. For example, North Dakota does not track their non-fatal injuries, so they're not reported. And actually Otis was a student who looked at that data with some data sources from North Dakota and tried to do some calculations and comparisons to other states in the region, and found that there were pretty high non-fatal injury rates in North Dakota, particularly in the industries you'd expect: agriculture, construction, but also in the oil fields out in the Bakken area. So you know, that's a lot of the smaller states don't even have the capacity to collect and produce that data. So there's a lot of there's undoubtedly undercounting, and there's smaller workplaces that in agriculture where things are not counted well at all. And then, you know, you get into longer term injuries. I think of, you know, you mentioned your hazards in your own job and home workplace ergonomics. You know, it's who's responsible for that? It's a kind of an open question, and people are, you know, I my own work setup, I had a chair that was kind of lousy, and it actually broke, fortunately, a couple of months ago. So you know, but I was sitting in that for, you know, what, 2 years at least, and working on a desk. I'm still working on a desk when I work at home. Most days I'm in at the U now, but that's not ideal. So, and there's a lot of people that have similar situations. I'm sure you're all, you know, making faces because you know what I'm talking about, because you're all doing the same thing. So you know, that's the type of injury that doesn't get counted well, unless it's in a situation where people are having lost work days and it's kind of reported through their workplace. And the occupational related diseases, you know, things that happen because of latency period 20, 30, or 40 years later aren't counted at all. There is somewhere around, I think, maybe 300,000 occupational illnesses reported around that number each year in the U.S., but those are recordable because they're more acute illnesses and things that happen kind of right away, and so they're a different type of illness. And so the counting is really difficult for a number of reasons, and I don't know, the solutions, I think, there's not a lot of easy solutions, but I don't know if you have any thoughts
Yeah,
around that.
Actually, I would agree with what you just said, and we do tend to see fairly good reporting here in the state of Minnesota. But still, especially with the migrant population and the smaller type of employers, obviously there is an underreporting there. We see a trend that follows the economic activity. When construction goes up, injuries tend to go up. When construction activity goes down, again, injury rates go down. You know, so there is a track there. And also we do see a lot of the culture, the workplace culture of safety, especially in the migrant population. You know, there's not a culture of safety in a lot of these populations, and there's also the fear of being fired or you know, basically just let go if they report an injury. So that fear kind of in turn triggers an underreporting. You know, what we do to try to fix those issues is we have partnerships with the different consulates, like the Mexican consulate and the Honduran consulate and Guatemalan consulate also, where we go in and we do workshops and we explain to the employees there that they are protected if they're to report, you know, a safety hazard at work. Those complaints are kept confidential. We in the state of Minnesota, we do not care if that employee is illegal or illegal. We don't care about the immigration status of that employee. So we try to break those barriers to encourage them to report issues that come up, to report injuries that come up. But it is an ongoing process. You know, it's certainly you know, it's not an easy job to do. You know, so.
Yeah, I don't have more to add outside the numbers are dismal, and we do need to do a better job of counting somehow, especially for those. So I don't know if I have any more.
I'll get it. Turning myself off.
There we go. So I am really interested in talking a little more. Dr. Bender, I know, well, actually, both Rainer and Bender, I feel like, talked about holisticness and breaking down silos as part of the stated goal. But at the same time, there, at least from my limited knowledge, appears to be more specialization in a lot of industry. So I'm wondering how to kind of reconcile that. I guess maybe specialization, but also you know, merging and, you know, larger and larger farming operations, larger and larger meat processing, poultry and such. So, which, you know, factors into disease transmission, as we saw with COVID. We saw, you know, these spikes in certain areas with meat processing plants. So I'm curious if sort of what's the approach and how does that sort of holistic mindset fit in with this ever sort of specializing landscape that we're in?
I think this is a really fascinating area, especially with the labor shortage and the fact that you know, there are some jobs that people just don't want to do. I mean, dealing with cow manure all day would not be probably the most pleasant thing. Or, you know, working in a slaughter plant is not pleasant. And so, you know, there are opportunities for, you know, robotics or other, you know, helps that might make the job better. So how do we have a constructive conversation about what robotics and what things technology can actually help improve? the life of the worker and the type of work, or removing certain work things that the workers are not going to do. So I think that that actually is important, and we are seeing that happen now. One, because we're not seeing that immigrant workforce come in. It's not easy to bring people to work on dairies because because of the current immigration policy. And so this is this dichotomy, this challenge of needing workers, but at the same time, basically not having the workforce come in. So I think that that's part of the challenge. So really, I think the bottom line is that there are opportunities, and we are seeing this, is that there are robotic milkers. There are now robotic feeders, on operations. And there are other ways that we can actually do it. I mean, the whole, I think of the sugar beet fields and the sugar beet transportation issues, especially during harvest season, where we see a lot of the car accidents. Is there room for, automated drivers and who are driving the speed limits on set ways, so is there a way of reducing some of those injuries and risks there? So from a hopeful standpoint, I think there are some prevention strategies that we can do as we look at technology for the future. I think it's a long ways off, and he probably has a better anticipation, one, because he's an engineer and he thinks about these things probably more thoroughly than I do as to, will we have self-driving tractors? Well, we do. But will they be able to drive sugar beets to and from, Fargo?
I don't know. I don't know the answer to that question, but maybe. So I think when you talk about specialization, sure, there's but workplace has always been specialized in one way or another. I think a lot of maybe the solutions that we come up with for problems can be thought about conceptually broadly that could apply to any sort of workplace. So, Jeff talked about robotics in agriculture, but there's, auto companies used to spray paint their cars have people painting them to apply, but for many, many years, it's all been robotic spraying because it's a hazardous material. There's an aerosol that has, colorants in it and metals and stuff like that, and it's dangerous stuff. So they've, for many years, had it applied through robotics and automated. And so that gets into the concept that I like to talk about with my industrial hygiene students, and we talk about with workers as well, and that's the hierarchy of control. And I don't know if that resonates with people here, but it's very important in occupational health and safety. And the hierarchy that we kind of have agreed upon as a practice is at the top is elimination of hazards or the processes that create them. That is frequently not possible in a workplace because then the workplace goes away. Substitution of materials or processes that are less hazardous than the ones that currently exist. Engineering controls, so things like automation, robotics, isolation of people or the process, ventilation, air pollution control equipment. For injury hazards, machine guarding, for potential violence, locks and security measures. So all those things are engineering controls. Administrative controls, which could be when or how the work is done. So it could be timed during shifts where there are fewer people around. If it's a hazardous operation, you can change your work practices. So those sorts of things are administrative controls. And at the very, very bottom is personal protective equipment. And that should be our last route. Of course, that was kind of our first route in the pandemic, right? We masked up. Or actually, though, we had administrative controls. We didn't go to work, or some of us didn't go to work. A lot of people who were essential workers did go to work. That gets into the equity issues too. But that all, those concepts, and there's other ones in occupational health too that can be applied to any workplace, I think are ways to think about safety and health issues across different types of workplaces, from large ones to small ones too. Large workplaces aren't all healthy and safe by any means, but they have more resources. When we think about small businesses, communicating to them, getting the word out is challenging. And it's even harder when people are individual contractors who gig work and things like that.
Thank you, Pete. I would tend to agree with what Peter and Jeff's said, and we do see a trend towards automation and robotics. Even in the construction industry right now, we are seeing trends of more prefabricated parts, parts coming in already pre-assembled at the factory, and that does cut down on the the labor and eventually on injuries too. In the restaurant industry, we also see a big trend for robotics. You probably heard about automatic fryers and that type of thing. And again, those are kind of parts of the job that people don't like to do just because of the nature of the job. We did do a lot of investigations. We had some issues at the meatpacking plants, and that tends to be an ongoing issue here in Minnesota and in other states, Midwestern states. And it is a job, it's just inherently dangerous. You know, they're dealing with saws and cold temperatures and a lot of hazards. And we are trying to reduce those. But I see education as a crucial part in a factor to try to diminish and eliminate some of those hazards. And once the employees do know what the hazards are and how important it is to protect themselves, that seems to really do the job. And I always approach them as, especially in the Hispanic community, the family is really important. So I always address that and say, you know, how do you feel if your wife or your mom doesn't get to see you anymore? You know, and that seems to get cut through those barriers, you know, to try to get them to pay more attention. But yeah, labor shortages are a huge factor.
Can I? Sure. You haven't talked about how fantastic OSHA consultation actually is, that we have this thing that workplaces can come. People think of OSHA as being, oh, they're going to find me, right? They're here to get me. OSHA consultation is the opposite of that. They're trying to help you, and so maybe I'll let you.
No.
Can you? Okay. I mean, it's a fantastic thing that Robert does. It's that, yeah, it's free, and they go out and they bring solutions to the workplaces, whether they're large or small or whatever. So, I mean, anybody out there who's listening to this, tell everybody you know that there is this opportunity for people to get help with their workplaces for free, and to avoid, see the good side of OSHA, which I think the compliance part is a good thing too, but this is all to help people.
Yeah. Oh, thank you very much, Peter. That I couldn't have said it better myself. Basically, OSHA has that's the good side of OSHA, which we call it OSHA consultation, and it's free of charge. So any employer can just call in and request a hazard assessment. We do not issue citations when we come in. We do not talk to OSHA compliance about anything that we see there. So there is that confidentiality. And on top of all that, if you find that you need, let's say, a new ventilation system in your tool shop or in your machine shop, there are funds there, which are grants that are issued by OSHA, safety grants, that don't need to get paid back. So there's free money there too, as long as you use those funds to make safety improvements. So it's a win-win kind of situation, and I love working for OSHA consultation because I'm welcome. When they invite us to come in, they're not running away when they see me. So it really definitely is a great resource. We also issue. We have training. We give training in both Spanish and English, and we again free of charge. So it's definitely a wonderful resource to take advantage of that. So thank you for plugging that, and thanks.
You've been in Minnesota too long. You're too humble. That's what's happening. Well, one Wonderful. Thanks so much for that. Sort of the high level and kind of the smaller, more granular. So we are at the period where we are going to have some table discussion. And on Facebook, I assume we'll have some Facebook discussion, however you do that. You're typing away. Any questions you might have. So we will now take until 9 o'clock and have folks discuss and write down on your card if you have any questions that you would like to ask the panel. Anything else process-wise? Okay,
Take a little break.
great. Thanks, everybody.
Thank you.
Yeah, I wanted to make sure that.
You guys ready to go again? All right, great. Thanks for doing what I've been holding it up close to the Facebook.
Yeah, okay.
Thank you guys.
Okay, let's get back together, folks. We had some really good discussion, and I have received some great questions from the folks at the tables. One of the questions was about if there's any work going on with designers and architects to design and build safer workplaces.
Yes, there actually is. So you know, I think part of the discussion around the pandemic has really, you know, this may be different from kind of heavy industry, but in a lot of our office spaces and businesses that are in buildings that are kind of like this, that are have HVAC systems. There's been a lot of learning, I think, that's gone on about the importance of ventilation and having higher turnover of air from your air handling unit, having better filtration, having more outside air, as much outside air as you can have. It's hard on a day like or winter time in Minnesota and northern states where you have to heat the air also when you bring in fresh air. But I think that's one thing where occupational health and architects and facilities engineers and designers have learned a lot about the need for better ventilation and are kind of working towards that. So that's an example of yes. I think there's also you know, other examples where it comes into safety and design of. I'm thinking of a particular study that was done on a healthcare facility that was a mental health facility for youthful offenders in New York. Had a terrible issue with violence to the staff. And they went through a whole process of how to design the facility in a way to reduce the violence. So they did some simple things like putting locks on doors where there was only staff access, putting the nursing stations up higher so it was harder to reach in, so that made it safer for the staff. But they did other things that were, how do you design the flow of the facility so that when people were going to see their appointments, they would move in kind of a circular motion, a circuit, rather than crossing paths. And one of the sources they had found of violence was different patients getting into fights. And so the staff would then have to come in and break those up, and that would cause injuries. So by moving in a circuit, you prevent those as many interactions of the patients. So, you know, it's those sorts of things that can be done to think very carefully about a design of a facility that could prevent injuries. So there's, you know, those are a couple different examples, both from the health-based side and one from the safety side, where yes, those things are done. And I think there's a lot more that can be done to help architects and designers understand some of the things that they can help with.
You know, it's The answer is a simple yes. And actually, I think that there's more work that needs to be done. I mean, just give you one example on the animal side, which I think is kind of fascinating, is that many of our swine operations are big, and they do need air exchanges, and they do know that if they can improve the filtration, we can actually reduce the disease transmission among those pigs. With the thinking too that we can also prevent disease in the workers. So clearly, there's work just being done on building design and filtration issues, even on the agricultural sector. And I think more work needs to be done. The cost is the issue. I mean, when your margins are so much an issue in agriculture. But again, I think that we want to encourage that interdisciplinary discussion about health and how does that relate. And I think the pandemic has really highlighted the importance of ventilation in particular.
Do you want to say anything about the roll bar stuff on tractors? I mean, that's a design.
And that's a great example too. Just how do you design things better? And so you think about the tractors of the 40s and 50s, that Grandpa used to have, and you got this big wheel rolling there, you've got something moving around the back. So there was so many potential for injuries, and they would roll over because they were so unstable. And so just putting simple roll bars on that, and basically there's a number of building mechanisms, not only within the state, to actually support farmers who want to add roll bars on, but actually nationally too. So some simple design issues can really prevent deaths and significant injuries.
Thank you. My next question is from the group, but also one that I've been thinking about too, is about the labor shortage. And we've had some comments about that, but I'd like to dig into that a little more in terms of how has that impacted organizational safety cultures? For example, has that provided an opportunity for some businesses to try to attract people based on having a good safety culture? Or alternatively, does it appear to be eroding some safety because of short staffing potentially?
Maybe I can put Robert on the hot spot.
Yes. Thank you. It's kind of good and bad both. I have noticed that there is a trend to when specifically I'm speaking here in the construction work sites. It used to be much easier for the superintendent of that construction site to tell a worker that wasn't wearing his PPE or not following the rules, just go home. Just go home, leave the work site. But now, because of the labor shortage, there's that obviously that pressure to keep that employee working. And I have noticed, in some instances where they're a lot more careful. Now that the superintendents are a lot more careful. So I think education again is one of the crucial factors here, where if you can educate that employee, why is it to their benefit to be wearing PPE, to be protecting himself or herself in the work site. I think that is the way to go. But I have noticed in many instances of people not being let go when they should have been let go because of that labor shortage. But definitely what you mentioned initially about making the workplace more attractive, that from the safety point of view, that's definitely a plus. And I think that could be exploited more. To promote safe workplaces. Yes.
So one of the things that my Midwest Consortium training centers have seen is that so people working in hazmat are supposed to have 40 hours of training, and that would seem to be the thing you want to do, is get new employees to come in and do that training. But some of the industrial partners are seeing enough turnover in their workers that they're reluctant to invest in sending their newest hires to the 40-hour training because they think they're going to move on within a year, and they'll have invested this week of their time in this training and pay for it, and then they're going to be gone. So, and those are the employees that are probably the workers that are in the greatest risk because they're the newest to the field often and things like that. So it's a real conundrum for our training centers because these people should be getting trained, but they're not. So that's you know, the mobility of workers and the new situations they get themselves into can you know, create more hazards because everybody's new to different workplaces if they're moving around.
Okay, I've got another one. I think we can't have a panel without talking about cannabis because it's the hot topic. It's the topic du jour. So curious to hear if you have any strategies to share in dealing with cannabis at work, but I think also, you know, as we were looking at potential legalization here in Minnesota, so the impacts of people coming to work or traveling for work while impaired. And, you know, it's fine if there hasn't been a lot of work on cannabis specifically, I know, because it's been, of course, we haven't been able to study that, but also curious if you have any reflections. I know someone mentioned in opening remarks that opioid impact, and so just any further reflections on impairment and drug use at work.
Yeah.
I mean, I can, if you want to start,
You know, I think this is a concern. Actually, we've really heard this from kind of public safety officers. You know, just driving, especially heavy equipment issues. I think you know, big rigs and just you know. So I think that these are issues that, especially that I'm hearing from the public safety side of concern. From the farming industry or agriculture industry, I have not heard these issues. And so, but at the same time too, you know, here we've got, you know, big equipment, you know, the chances for making mistakes or not being more safety aware are going to be some big issues. So I think that it is something that we need to raise, and I think we need to have that discussion, you know, as part of it, especially as we move towards more recreational. The other concerns is basically spillover in households to children, to pets, to other things where we are seeing some challenge. At least the literature is really suggesting that, especially, you know, out of Colorado. I think I've seen most of those concerns coming out of the pediatrician's office, from the veterinary community, et cetera. So I'll let you add to that.
Yeah, it's a difficult issue because there isn't a good way to measure impairment to marijuana, right? Employers will do drug tests, but that's looking at residues, and that doesn't tell whether somebody's impaired. And people have rights. You know, they're doing something that's legal now. And there's a labor shortage, so if you're starting to weed out people because they're using weed, good pun there by me. That you know, you're furthering that issue where you don't have workers. So you know, workplaces have to think carefully about this. Most states do still, that have legalized marijuana, you still have some allow workplaces to dismiss workers or have repercussions because of a failed drug test. So, but the workplaces have to think about how they would implement that, because if they're going to not be able to hire people, then a lot more people are using now because of the legalization, right? So it really puts some limits on them. You know, there's with the broader issue of substance use. You know, the employee assistance programs are really important for that, and having workplaces have robust ones that aren't punitive are important, so they can assist workers and for people they may have invested training and many years in, trying to keep them employed is really, I think, can be a beneficial thing. Also, unions are fantastic. They generally have the best assistance program, member assistance program, MAPS instead of EAPs. And they're fantastic, many of them. So, you know, having a helpful, supportive member or employee assistance program, I think has a lot of benefits to the company and to the workers, rather than just dismissing them, helping. You know, that's something that I would hope many workplaces would increase, because that can really help with, you know, the epidemic of opioid use and other substances.
Great, thank you. I think we have time for one last question, and I can't get by a policy forum without asking about policy, kind of the big P policy. So curious if there are any potential policy movements that you all are following either on the state or the federal level, and looking to tracking for making improvements on workplace safety.
I'll just start with one that, you know, that I see, you know, really from the pandemic side that we probably need to address. And this actually reflects more of a healthcare approach, is the issue of telemedicine. How do we provide telemedicine support and a mechanism? There is, especially from the mental health standpoint, there are a number of big issues there. One is that we don't have enough mental health advocates or resources to address many issues. Many of the issues, especially for underserved communities, you know, I think we have one Hispanic psychologist in southern Minnesota that might, you know, deal with things, but how do we actually provide some of those resources to underserved communities? Can we do it through telemedicine? The other issue is being able to provide telemedicine across state borders. So if we have a mental health expert in, you know, Winona, they can't really work with anybody in Iowa or Wisconsin. And so from a standpoint of a policy and a policy towards health and safety, I think that is actually, you know, one policy thing that I do see continued need for discussion and work. And I know that in particular, Tina Smith's office has been trying to address this issue, especially with the pandemic.
Yeah, I'm just going to kind of second what Jeff was mentioning about mental health, and we have been noticing a trend both in the construction and in general industry of more drug abuse, a huge increase in suicides that are really alarming us, you know, and that definitely affects the safety and health of those employees, you know. So that is definitely something that's going to be in our forefront, you know, and you know, where we're going to have to just concentrate on that and pay a lot more attention to that. And I mean, it's something that kind of we try to do everything what we can from one perspective, but we're kind of still missing, or I think we're not doing enough to address those issues with mental health.
This isn't answering your question, I don't think, but you know, one issue that we have is diversifying our public health and our occupational health workforce. You know, I think there's you need to have, to do that, you need to have more leaders who are diverse. I think in the School of Public Health and our faculty, at one point, I think we might have had one black faculty member across the whole school of like 100-some faculty members. That's changed. So that's a good thing. It needs to change more. It's building, but that's something we're trying to bring in. I try to harder to recruit students from diverse backgrounds than I do other students. I try to recruit them all, but you know, as far as money and trying to bring them to Minnesota, there's one I'm working with now from Alabama, who is black, and I think she went to Tuskegee University, and is great. But you know, all the other schools are probably trying to recruit her too. I'm doing what I can, and I'd feel great if we were able to get her to come to Minnesota, and maybe help to diversify our workforce. So you know, that's a broader policy type thing. It's not maybe an official policy, but it's something I think we need to work towards, to have people who can talk to the different populations we have in our workforce, and Robert's able to do that. So he's an example of somebody who brings diversity to Mid-Osha and can talk to people in multiple languages. Jeff and I probably have less ability to do that. So we need more people who can do some of the things Robert can do going forward.
Wonderful. Well, thank you so much. I think we'll just, why don't we take a moment to appreciate our panel here. All of your thoughtful comments. So I'll just take a few minutes to sort of wrap things up, and then Kathy will get us out the door. But I love that last comment, because I think that sort of brings us to kind of starting to wrap us up a little bit, and pulling together some themes that I heard this morning, in terms of, you know, really where some of the silver linings are appearing around advancements in technology and engineering, but how that needs to be married with sort of turning the regulatory bodies like OSHA towards a more sort of human-centered and education approach. So sort of the head and the heart coming together. And I really appreciate too that there is some really good movements towards focusing on mental health. I think we see that, you know, in all of our local public health assessments and our state health assessment, that mental health keeps popping up as a #1 priority. So it's really great to hear that focus is there in the occupational health as well. And it's, you know, I wasn't certain that there would be much of a crossover between my work and what I would hear this morning, but certainly telehealth and mental health services is something that I know that health plans, of course, are very focused on as well. And making sure that those pandemic waivers and things that we've been able to do will continue as appropriate, and to make those services available, not only just available, but culturally relevant and appropriate, since mental health services are, of course, very culturally bound. So, you know, and it's heartening to hear that that we have such great organizations and such great work on the whole health approach. I think that is really something that is providing some positive outlook as well to try to marry together, and of course, Dr. Bender, you've got the animal human approach, but also crossing over all of those human silos that we put up, so just recognizing that whole health approach is I think where we need to go, especially as we move towards you know, holistic approaches in sort of all areas of public health. So I really appreciate everyone's time this morning and your expertise. I said I was coming in as a learner, and I certainly learned quite a bit, and I hope you helped as well. So appreciate folks listening and all your questions as well from participants.
Thank you, Annie, and thank you, panelists, again. I just have a few announcements. If you're not a member of MPHA already, we invite you to join us. Please consider joining and getting involved. We've got many opportunities for working on public health issues and supporting initiatives that can really make a difference. Mary Grand is the executive director, and you can see her afterwards if you're interested in joining. Our next forum is scheduled for March 24th. Safety is no accident. Public health approaches to injury prevention in our communities and schools. And then finally, our annual conference for MPHA will be held the afternoon of Monday, May 22nd, and the morning of May 23rd. It will be offered in Moorhead at Concordia College in person, or there will be also a virtual component that is going to be available. The theme is raising the public's health, becoming better ancestors through history, hope, and action. We're still looking for presentations. Requests for proposals for breakout sessions and poster sessions are now open through January 24th at 5 p.m. So please submit your proposal through the link at mpha.net. And then finally, thank you everyone who's here for braving the January darkness, cold, and the ice that's out there, speaking about safety. And hopefully we'll see you on March 24th. And thank you to all who have joined us online too. So with that, hope to see you on the 24th. Thanks.